Okay, I'm going to show you how to wrap a lower leg. If your patient has swelling, you're going to put the stockinette on first. You want it to end around the popliteal fossa and go all the way up to the base of the toes. It could be a little longer up top, so it'll fold over if you want. So we will start with the toe wrap. If the patient has swelling in their toes, you're basically going to do a figure 8 around the foot and then around each toe. If it wants to slide off the foot, you can do it around the ankle right here and then around the toe. So let me show you how to do it around the ankle part. So I do about a loop and a half there, and then I'm going to lay it over the top of the toe, start at the toenail, and slowly work my way inward, overlapping generously. So depending on how big or long the toe is will depend how many loops you do. So if I came from this direction, after I do my loops around the toe, I'm going to leave the other direction. So you'll see a V at the end of each toe. And then I'll go around the ankle or the foot, and then I'm going to go to the next toe, lay it on there, try to make it smooth as you can. And you don't usually have to cover where the nails are, because usually you're not going to get swelling there. And you want to get on either side as close to the base of that toe as you can. Again, if I came from this direction, I'm going to leave the opposite direction. I can continue to do all the toes, but I'm just going to show you those two. If you've got extra like I do, you can loosely go around the foot or the ankle with it, and that'll give you a little extra padding and protection from the bandages. And usually when I'm done with the toe wrap, I'm just going to tuck it in after. So I'm going to just take this and tuck it in like that and make it kind of smooth. All right. If I needed some padding around the ankle or the heel because they have skin irritation or the top of the foot, you can use this artiflex and create some padding there like that. Okay, now I'm going to take my 8 centimeter of the short stretch and I'm going to start above the ankle. You want the tail to come out from the underneath and the roll to be on top instead of like this. It just gives you a little more control and ability to get the tension right. So you're going to circle above the ankle, and then you're just going to start going down toward the foot. Once you get as low as you can, you want the patient to keep their foot at a 90-degree angle, so when they stand, it won't bunch and gather at the front of their ankle. If they can't do it, you have to physically help them hold it up. So I'm going to go around the foot, kind of toward the toes. If I see a wrinkle like I do, I'm going to smooth it out like that, kind of right at the base of the toes there, and then I'm going to do another loop at the midfoot, and then I'm going to cross over the front of the ankle and get my malleoli. I'm going to do about 2 or 3 of those figure 8s, or I call them snowmen because it's a loop here, here, and here. So I'm going to go again over the top of the foot, going right close to the toes, and then midfoot, and then around the malleoli. Usually this is where patients get their most swelling, right here on the sides of the ankle. You can put pieces of foam in here, kind of like a donut, to let the ankle bone kind of poke out. All right, we'll go ahead and do one more. Again, keep your foot at a 90-degree angle. Smooth out your wrinkles as you go, and then you're going to go up the leg, overlapping about half the width of the bandage. If it gets tucked under there where you can't reach it, you can fold it under like that and tape it. I usually use masking tape. I don't use the clippies that come with it just because these are sharp and my patients are at risk for infection. Okay, the last two bandages we're going to use are the 12 centimeters, and we're going to start as low as we can around the malleoli and circle up until we get to the popliteal fossa. You want your tail to kind of be aimed upward a little bit. If I do it straight across like this, that bandage might start unraveling, and then they'd have a trail of bandages as they're walking out the clinic. So you don't want that. So you want to aim the tail up a little bit and then go straight across. And this leg that I'm wrapping is pretty tiny, so I'm going to only put the space about this much. With a larger leg or a longer leg, you might want the space maybe covering about 2/3 of the last bandage. So I'm going to keep this one close. And your tension is just kind of a steady tension. It's not yanking and it's not loose and wrinkly. So you do put a little tension as you go up. The important thing is getting your spacing to be the same as you go up. So I'm looking at the space between each one, trying to make each circle perpendicular to the leg, going up the leg, and my goal is for it to land and finish right at the bend of my, right before the bend of my knee. All right, and with my free hand, I'm kind of feeling for wrinkles, making sure I'm not getting wrinkles in my bandage. Okay, that was pretty good. Now I'm going to tape it. Now, if you're instructing a patient, you want them to know that with the first 12 centimeter, you want to go one direction. With the second, you want to go the other direction, because you don't want all that tissue over time to always rotate in one direction, because it will mess you up. So I'm going to again aim my tail upward a little bit, but go straight across, trying to get the malleoli. Going to go a tad bigger with my spacing between each. And again, my spacing is symmetrical. The same as I go up. I want to keep the tension the same as I go up. Just like that. I'm almost done now. I'm actually going to cover that. And I want my tail to kind of aim down just a little bit so it can be on the other ones, and then I can tape it. If your patient says, oh, the tape doesn't hold, you can do one loop all the way across, all the way around, so it's taping onto itself. Okay, when you're done, you want them to wiggle their foot up and down. You can kind of squeeze on it. When I squeeze, I should feel it firmer down here and mushier as I go up. That's what my hand should feel. If it feels like mushy right here, I know this is an area that's going to want to swell. So the next time I wrap, I want to make sure I either add another layer here and really make sure that tension feels the same. But otherwise, it feels good. And they should be leaving these bandages on until I see them the next time, or if they have to take it off because they have pain or they want to practice, they can take it off, take their shower, and then re-roll all the bandages up and put it on again. And that's it.